for joining us here on the Urban Debate on the topic number 2. Viewers, this is an extremely concerning trend that's emerging in our cities. Extensive research that has been done by medical experts in Mumbai has flagged it off. But it could be happening in other cities as well. A massive concern for our children and their vulnerability, not just towards COVID, but a life-threatening disease that's now happening to children who've contracted COVID and recovered from it, but then ended up having this syndrome. It's a sudden spike that we're witnessing of the life-threatening disease called P.I.M.S, P.I.M.S in children. And this has become a cause of concern. P.I.M.S stands for Pediatric Inflammatory Multi-System Syndrome. It's a disease that affects infants, children, even teenagers. A rare systematic illness that's usually between the age of 0 and 19. Symptoms that you see include persistent fever, extreme inflammation, especially in this case after exposure to COVID. It can lead to medical emergencies such as shock, organ failure, and even death. Now, if recognized on time, if detected on time, then due medical treatment can help and save you. In fact, so far what we've seen is that the fatality is about 2% in these cases. But it does require intensive care and adequate supply of oxygen for treatment. So what we are seeing is, and this trend has only intensified in the last few months, or perhaps that's when the medical experts started tracking this as a trend and started collating the data. But children who first contracted COVID were treated, went back home, then later on began to show symptoms for this disorder. What does it mean? What is the connection between the two? Is it happening in other cities? Let's ask these basic questions to the medical experts who are joining me right now. How big is this as a threat to the children of our country? Dr. Supratim Sen, Senior Consultant Pediatric Cardiologist with SRCC Children's Hospital in Mumbai, joins us this evening. Dr. Prakash Vemgal, Director of Pediatrics and Neonatology Department at Rainbow Children's Hospital from Bengaluru, joins us this evening. Dr. Sagar Bhattar, Consultant for Pediatric Immunology at the Aster CMI Hospital in Bengaluru with us, and Dr. Bakul Parekh, he's the CEO of the Bakul Parekh Children's Hospital and the National President of the Indian Academy of Pediatrics, also with us this evening. Dr. Parekh, let me begin with you. If you can help us understand, just how big a concern or how many of such cases are we actually seeing right now?
Yeah, so it's a very pertinent question. We are seeing this P.I.M.S in relation to COVID-19 since last many months, and the cases are on rise everywhere in the country. And in Mumbai, we have nearly seen around more than 50 patients in various hospitals where we are dealing with tertiary care. And as you rightly said, it involves a persistent fever for more than 3 or 5 days, involving major organ systems, especially cardiac system, kidney and GI tract, and child can become very bad and can develop shock-like situation, and they usually require intensive care, though with proper treatment and early diagnosis, they can recover very well without much morbidity. So definitely we have to be on the lookout for a case of P.I.M.S in any case of child where fever is persistent for more than 3 days, and it involves either renal system or GI tract system like vomiting, pain in abdomen, appendix-like symptoms, or shock, or there is drowsiness or lethargy in the child. We have to be very careful and pick them up and do some tests to confirm the diagnosis, which will be related to COVID-19 in terms of either antibody test, or in some cases we can get RT-PCR positive.
Okay, in fact, for our viewers to understand what you said about more cases emerging recently, and our reporter actually spoke to multiple hospitals and tried to collate this data. Till July in Mumbai hospitals, we had a record of about 36 cases of P.I.M.S, but between July and October, the number of cases actually shot up from 36 to 140. And that is why suddenly there is a bit more concern and a conversation which is happening about this right now. Dr. Sagar, if you can help us understand the connection. Is COVID triggering this or making children more vulnerable, and why is that?
Yeah, so I'm a pediatric immunologist and we deal with immunological issues in children. And as rightly pointed by you in the beginning of this discussion, that many of these kids were contracted COVID, went home well, and a month later presented with this complication called this multi-system inflammatory syndrome, or what we call PIMS or MISC. So naturally, what you can see is many of these patients actually, or these children, do not have active COVID infection. It is believed to be an immunological reaction of the body to COVID infection, wherein children probably have recovered out of this infection, developed antibodies, and then as an immunological reaction, the children are presenting with these symptoms. So there is a clear link between COVID and occurrence of this syndrome, which first was reported in UK and then in US, and I am sure in India, several cities are reporting, as we are reporting in Bangalore now. And yes, there is a clear link, but it is an immunological reaction. And essentially, a month or 2 months later, after contracting the COVID infection, children are presenting with high fevers, rashes, low blood pressure, cardiac involvement. And the good thing is we have effective treatment available as of now.
Okay, so you're saying there is effective treatment, if we are able to actually diagnose this or detect this, at a quick enough pace. Dr. Sen, would you like to comment on this? How
Yes.
soon after treatment of COVID do these symptoms really emerge? What is it that people should be looking out for, parents whose children may have contracted COVID?
So the initial COVID in the children might be totally asymptomatic, and then they might present 4 to 6 weeks later with this condition known as PIMS. And there, as the previous speaker said, they present with a fever and a rash, and sometimes they can come in very sick and need ICU admission. Routinely, when we suspect this, we send off the testing, and we also do a cardiac evaluation, which includes an echo where we are looking for the function of the heart. And we also look at the vessels which supply blood to the heart, which is the coronary arteries. Now, if we suspect this and we start the treatment early, luckily for us, the recovery is very good. So studies internationally have shown that about 75% of these patients have complete recovery of their cardiac function within about 5 to 7 days. And in our personal experience, as of now, we at our hospital have seen about 40 patients, and we were also part of a multi-center trial where we studied 23 of the early patients in Mumbai. And we saw that the recovery was complete, and at least in the midterm follow-up, which is we have around 6 months of follow-up, we have not seen any long-term sequelae of these.
So let me ask you this, because you said, in the 40 cases that you observed and managed to treat, in how many of those cases were the parents or the family aware that their child had contracted COVID? Because often it can be asymptomatic as well.
I would say very few were actually giving a definite history of having contracted COVID. So some of them, family members, did turn out to have RT-PCR positive, but the large majority had antibodies positive and RT-PCR was negative. So the initial infection was absolutely asymptomatic for them.
So that actually is a very important aspect here that everybody needs to understand, because you may not even know your child may have contracted or been exposed to the infection, may have the infection, his body may have managed to fight it, but it could lead to other complications, including the inflammatory multisystem syndrome, which could then become very dangerous if it's not treated on time. Now, on time or soon enough being the operative part, Dr. Vemgal, how quickly should we be able to give the treatment to save the life?
So good evening. Thank you for having us today. So, it's the most important thing is whenever a child comes with prolonged fever, or if they have a history that this child was exposed to COVID previously and the child is still not doing, and there are clinical symptoms and signs where the parents kind of find out that their child is not doing well. is the time where they have to seek attention. So most of these kids are seen in the OPD basis. Some of them come, the good thing is majority of the children who come to our pediatric OPD, they are asymptomatic or they just get better, as the previous panelist said. Some of them will continue to have, persistent fever, rash, body pains, and they feel fatigue. They don't feel like being very agile and they don't play around. That is the time where you need to have a strong suspicion. And when you have a strong suspicion during this period of COVID-19, the common test which you need to do is RT-PCR. As we know that the RT-PCR can be negative in 60% of the children, but you can do a serology where you can probably pick up around 30 to 40% of them. But both can be negative, but still around 5 to 10% of these children can have these P.I.M.S. So it's very important to identify the clinical symptoms and seek attention with the local pediatrician or any person. They can go to the hospital. And I think the awareness is more important during this period. I think we have gone through a lot of illness over the last couple of years. Like dengue is the common symptoms where people used to be aware about dengue, and that is where parents used to come and say that why can't we get dengue test. So now the parents should be aware that okay, let's go to the hospital, get it checked. So the other panelist, mentioned the earlier you diagnose is one of the trivial complication is the cardiovascular instability. The heart starts to fail, and then the rest of the system starts to give away. So when there are 2, 3 organs like kidney, liver, heart kind of not functioning well, then those are the sick ones which we probably will be sorry to save them.
Um, uh, I want to actually go back to the to a point that you just made, Dr. Vemgal, which was about the accuracy of the COVID tests. And in children, how there is a possibility, a larger possibility perhaps of a false negative. If you can just elaborate a little bit more about this, because I don't think it often gets spoken about or people know about it.
See, when you look at the Western literature, when they looked at all the children came with these symptoms, when they did that testing, serology was positive in 60% of them, and the RT-PCR was negative in most of them, the remaining ones. When the children were again looked into it, around 30 to 40% of them were positive for RT-PCR. But there are around 5 to 10% of the children may be negative for both, like the antibodies are not there, the RT-PCR is negative, but there are clinical signs and symptoms of this multi-system involvement due to COVID-19. So irrespective whatever the signs and symptoms, whatever you get the laboratory values, it's important to take the attention and treat the child as early as possible.
Okay. So
may I pitch in here?
Yes, please go ahead.
RT-PCR, it comes negative because this starts after 4 weeks of exposure. So the strong history of contact with COVID-19 in the family and these symptoms which are involving GI tract and heart and kidney with some rash and conjunctivitis, which is not exudative, there is no discharge, and there are some mouth ulcers. And if you find the ESR, CRP and inflammatory markers which are very high, you do not worry about RT-PCR. You straight away go for the antibody test, which will prove that child was exposed to COVID-19, and that's how we pick up the diagnosis and start the treatment. That's why you get RT-PCR negative in many cases of P.I.M.S because they come after the 4 weeks of exposure, and usually RT-PCR comes positive in first 10 days.
Right.
So that is the reason why it is not seen.
Right. So we would also have to look and do the antibodies test to see if that's what is triggering it. But outside of COVID, what could be the other reasons that anybody could become, prone to or could get P.I.M.S?
So if I may add here, can I add
here? Yes, please go ahead.
Yeah. So see, in the pre-COVID era, we know of a condition called Kawasaki disease, where children came with fever, as Dr. Parekh mentioned, red eyes, rashes, and we used to diagnose them regularly as Kawasaki disease. And this disease is known to us for last 60 years, and we know what is the treatment for it. And similar to P.I.M.S, these children had cardiac involvement. So that was what we have read and understood in the pre-COVID era. in the COVID era, once the P.I.M.S started getting reported, people in fact called it as the Kawasaki related to COVID-19 because the features are very, very similar to Kawasaki disease. In fact, a proportion of us believe that this is Kawasaki disease triggered by COVID-19. So I would, at least for the viewers here, re-highlight that fever for 2 to 3 days, red eyes. I think this is one of the first prominent symptoms which we have seen in our children presenting to the hospital. And if treated in time, these children get better. Science knows much about Kawasaki disease. Since this is a new disease, about P.I.M.S, we are only able to understand in the last few months, and we should get better as we understand the disease better.
So if I had to ask you this question, you're saying, Dr. Sagar, that P.I.M.S is a relatively newer syndrome and disease that we're looking at in the COVID era. Before that, there wasn't much known about this either?
Yeah. The term P.I.M.S, in fact, has been introduced only after April 2020. There was nothing called P.I.M.S in the literature of medicine. The term has been introduced only in late April when first in UK they started seeing a few cases. And since they started seeing a large number of cases within a short period, they tried to relate it to COVID-19. The antibody test came back positive, and that is where this terminology came into picture. But when doctors realized that this looks very much like Kawasaki disease, we started treating them on the lines of Kawasaki disease, and fortunately, most of the patients have done well. So yes, the term P.I.M.S is a new term to medicine.
Dr. Parekh, would you like to add to this?
So ultimately, it is same as Kawasaki in the pathogenesis wise, because there are lots of inflammatory reactions which are unregulated, and that's why it causes multi-organ involvement. And ultimately, treatment remains the same, that is steroids and your IV gamma globulin. And if you detect it in time, they respond very well. Only difference between Kawasaki and P.I.M.S is that in P.I.M.S you get more of cardiac involvement, myocardial involvement, and that is leading to the shock-like situation. While in Kawasaki, it's more of coronary involvement, and that's why it is not very sudden at times. So that is the only difference. Otherwise, treatment-wise, it is quite likely that it is similar, and if it is picked up in time, they respond very well.
If there is a delay in detecting it, in responding to it, Dr. Supratin Sen, what could be, even if you're able to save the child, what could be the longer damage, if any at all?
Well, we don't really have long-term follow-up yet. As Dr. Sagar said, this is a new disease first described in April. So we only have about 6 to 8 months of follow-up. But what the studies are showing is that the ones who have a recovery in the first couple of weeks to have a normal midterm follow-up. We have not personally had any experience where we've had long-term sequelae. So unlike Kawasaki, where the coronary arteries get dilated if you don't treat them in time, in P.I.M.S, I think the time frame is to do with if we can start the ICU management for the sicker kids in time. So if they come in with shock, then you need to stabilize them in the ICUs. And that is where the window is for starting the treatment and stabilizing the patient. Once that is done, once the treatment is started and there's a recovery, we don't really see any long-term sequelae.
In fact, my research team has pulled out data as per the US CDC, which talks about the symptoms, and there's fever, abdominal pain, vomiting, diarrhea, neck pain, rashes that, like we said, and the picture shows that, bloodshot eyes. There are also additional symptoms if the child is obviously facing trouble breathing or has any kind of respiratory issues, inability to stay awake, we're given to understand, severe abdominal pain, bluish lips or face. These are some of the symptoms that internationally have been noted and recorded for this syndrome. But just to understand, Dr. Prakash Vemgal, is there an advisory in our country from the ICMR or any central agency for even with the medical fraternity to be a little bit more alert about this and spread the message or make people aware as well?
Well, according to my knowledge, among the medical fraternity, I think most of us, like especially the pediatricians, we are facing this. We are all aware about this condition. I think majority of the practicing pediatricians are aware about this. But in terms of the message which has been disseminated to the public or to the parents, I don't think so much has gone into them. Though we are continuously kind of doing some of these webinars to the community in and around the respective cities, I'm not sure how much it has penetrated to each family, and particularly to the rural areas. Since this is kind of affected most of people all around the world, like even in the remote villages, we are not sure whether that information has gone to the children in the rural parts of India. I think the next 6 months is the time, or we don't know how many waves we are going to face due to COVID. I think this information has to reach as much as possible to the primary health center, medical team over there, and even to the parents in their local language. And I think that initiative has to be started, if not been started so far.
No, so here is my question, Dr. Parekh, and maybe you can come in on this. Do we need, is it a big enough trend or a concern right now for us to nationally start talking about it and spread the word? People need to know, that there is this kind of a threat perhaps for their children.
Yeah, agreed. So first, let me tell you that Indian Academy of Pediatrics has come out with the registry for COVID-19 already. We have also started with an app which is being done, used by all the healthcare workers. But to go to the parents and explain them about P.I.M.S, and maybe that may get them alarmed too much, because incidence of P.I.M.S is not really very high. And generally with the symptoms which is described, like vomiting, pain in abdomen, or drowsiness, or sort of cannot sleep well, or rash, patients are bound to go to the doctor anyway. And it is better that the doctors pick up this diagnosis early. And that's the reason why they should be more sensitized compared to the public, because public unnecessarily will get alarmed where they are not supposed to. And that's why IAP has believed that we should always do webinars, as Dr. Venu said. And at the same time, we have started with the COVID-19 registry and the app, which is sensitizing almost every doctor in the country. And we are picking up these cases absolutely in time. And hardly there is any mortality in this patient. That shows that we are dealing with them efficiently.
You agree, and I say this because like you experts are telling us that often the children are asymptomatic for COVID, so we don't know if there has been a COVID history. This is a relatively new syndrome that we are talking about. Most people would be unaware of it, and if the symptoms are as simple as conjunctivitis or bloodshot eyes and fever and rashes, it could be interpreted as many other things where parents don't want to expose their child to a hospital and try treating them at home.
Agreed, but then RT-PCR is always advised for any child who is in contact with COVID-19 patient. Okay. And they may turn out to be negative or asymptomatic. They go a little late, otherwise they are picked up. And the things like conjunctivitis, fever and rash, anyway, these patients are bound to contact the doctors because they are already worried about COVID-19. And they may not come to your consulting, but definitely they will do teleconsultation. And that is now become very frequent. And we are there to guide them. And there are so many helplines which has been registered by many medical fraternity and organizations and IAP. So I'm sure they are quite knowledgeable about all this. Of course, I don't know about rural area and taluka places, but definitely in the cities and mid-segment cities, they are all known to everyone.
If I may add here?
Yes, please go ahead, Dr. Sagar.
Yeah, I absolutely agree with Dr. Parekh. I'm sure we are talking about it regularly, and because it is the pediatric population that is getting exposed to this problem, as long as pediatricians and general physicians are aware of the problem, we must be able to tackle this problem well. Because this is also a season where we are also seeing dengue and other febrile illnesses. So everything should not be attributed to P.I.M.S, and overdiagnosis and underdiagnosis both would be harmful. And I think if pediatricians and general physicians, family physicians are aware of the condition, we would be treating the children in time. We also try to create a very brief video, a 10 minutes video on this syndrome, and circulated it. And it had got several thousand views. By doctors, indicating that doctors are showing interest in this syndrome. And with COVID-19 being talked all around, I'm sure we can diagnose this in time. Also, it is very important to highlight the fact that many of these children need ICU care. And that is very, very important, because if that appropriate ICU care is not given in the first 4 to 5 days, this can turn fatal. Although it is small in percentage, but there is a serious threat here.
So, because we are saying, yes, Dr. Vamkul, you wanted to say something?
Yes, as Sagar mentioned, ICU care is the paramount here, and the most important thing is referring at the right time. Why is it so important? Is the child might require as simple as oxygen supplementation to a extreme of we have to probably ventilate this child and put the child on a mechanical ventilator. And what the most important thing is what the cardiac output is, like how the heart is functioning. So you need to probably support the heart by mechanical ventilation. Sometimes, and majority of the times, when the blood pressure is not good, we may have to use some of the medications to support the blood pressure. And if you don't support that, and once again, I would like to reiterate that if the kidney starts to fail, the liver starts to fail, then it's like you probably are losing the battle. So that's very important to refer early, appropriate intervention, and there are key medications which has to be used at the right time. And a constant monitoring is very important during the first couple of days till the child get better.
Okay, and just my last question, Dr. Sen, maybe you can, weigh in on this. Because we are saying this is a newer syndrome, there isn't enough research. One question that is coming to people's mind, and some of them have actually written to me asking about what is the treatment then? How are the doctors and the medical experts going about treating this?
So at the moment, the treatment protocols have become standardized. As Dr. Sagar mentioned, there's a medicine called IVIG, IV immunoglobulin, and high-dose steroids. So these are the two drugs we specifically give for the immunosuppression in these patients because this is immune-mediated. In addition, we do need to support these patients sometimes on ventilator, and we need to give drugs to get their blood pressure up. Those are the supportive treatment protocols which are given. These patients also require aspirin sometimes because they are prone to clot formation. So these are very standardized protocols which have been published in literature, and most of us pediatricians are well aware of it. So the same treatment is being followed everywhere across the world.
And is there any information right now, any research or initial trends about who may be more vulnerable? I mean, of course, if you've come in contact with somebody in your family or around who has COVID, but otherwise, for example, for COVID, we say it's usually elders who or senior citizens or somebody who has already an existing condition. Dr. Parekh, is there any understanding of who may be more vulnerable to this?
Yeah, so usually comorbidities are always there to make them more vulnerable. But here, the age group which is usually affected is after the age of 9 years, up to the age of 16 years, or maybe up to 20 years. The younger age group is more likely to get affected by regular COVID or Kawasaki like this. But anybody above the age of 9 years who has been exposed to COVID-19 a month before, any develop this type of symptom, then we of course suspect P.I.M.S. And in these P.I.M.S also, more than 40% of the patients, they only develop mild inflammatory symptom like fever, and they respond very well to anti-inflammatory drugs. Only few patients will lead to some organ failure. And again, they respond very well if they detected in time by giving IV gamma globulin and maybe steroids. And of course, aspirin or your anti-heparin or some low molecular weight heparins may help if some of the inflammatory markers are very high. But generally speaking, they don't require too many drugs except for these few drugs which has been a set protocol, and they can be easily picked up.
All right. I am going to thank all four of you panelists for joining us and, sharing this information and shedding light on this very important aspect. I think a lot of conversations have become about COVID and justifiably so. It's been a life-changing experience for this entire world, for each one of us. But we also now need to start looking at the other challenges that are coming along with COVID. We've often spoken about the mental health impact. We've spoken about other physical, health impact or related challenges that have been noticed in adults. This is the silent one that's now becoming a bigger trend amongst children, which is why all of us need to be extra alert, which is why even our administration and our governments need to be a lot more careful before they start opening up schools. Our parents need to be a lot more careful before they start sending the children out. It's a tough call to make. For how long can you keep your child locked up inside? To what extent do you expose them to the outside world? But at least the one thing that all of us can do is arm ourselves with the information. And so this is what we are trying to do. We are trying to tell you that there exists this other syndrome, a life-threatening disease. While the fatality ratio is still just about 2%, it's still a lot. And it could be fatal, is the operative part. So you need to know and you need to watch out for these symptoms in your child. In the COVID era, be watchful not just for the COVID signs, which would be fever, cold, loss of smell and loss of taste and breathing problems. But in addition to that, if it's just fever and rash, if it's diarrhea, if it's abdominal pain, if it's rashes on your child's body, then don't wait for a single second. Rush for emergency care so that proper treatment can be done on time. More and more examples are emerging, at least from the big cities, where, like our expert said, the doctors are a lot more aware of it. There is a lot of conversation within them and they know how to spot it and treat it. But this is a big trend now internationally. And the first thing that we can do, at least, is make ourselves aware and be alert about it. Thank you so much for joining us on this conversation.